Well, hello, hello. I am your host today, MarcellaHill, and I am going to introduce you to this is Jill Petrie. She is the founder of Balanced Hormone Health, and I wanted to take a few minutes and help you get to know her and her practice, so you feel really comfortable calling them, booking a consult, and understanding what the entire process is in working with Balanced Hormone Health. I know when I got started, Jill, I had never used telehealth ever before. And it felt very, I guess, like not as good as local. Honestly, that was just kind of my initial thought about telehealth. And now my opinion is so opposite. So opposite.
Right.
I think that telehealth is absolutely the way to go. And being able to work with women that are so passionate about helping other women like yourself is really hard to come by. And when you narrow it down to like in your zip code, that is almost impossible. So to be able to work with someone like you and your physicians and your team from anywhere in the United States is just a gift. And I'm so, so glad that we found you. So I'd love for you to just jump in real quick. Tell us, how long have you had Balanced Hormone Health and why did you start it?
Definitely. Well, thanks for having me. It's great to see you again. And yeah, Balanced Hormone Health was founded in 2022. And because I was just like you and all your listeners, I was going through the exact same things. And I had been looking for providers and practitioners that could help and went from doctor to doctor, clinic to clinic, specialist, and was getting nowhere. I was like, I cannot live like this. So anyway, we saw our first patient in January of 2023. I have 5 licensed practitioners. We're based out of Iowa, providing telehealth via video visits through to both men and women throughout the U.S. Our specialty is injectable bioidentical hormone replacement therapy and weight loss injectables for both men and women. And so we use top compounding pharmacies, sending everything directly to your home. And like you, I was, a little concerned about telehealth when I first started it because I was like, well, who am I? But then when I got to actually pick who I wanted to see anywhere in the United States and find a fit that worked for me, I'm like, this is what I want. This is what people need. This is what women deserve. And so that's why I kind of started this company, is just because it took me years to find a telehealth company that I could work with that provided what I needed. And I'm like, it shouldn't be this hard. Women deserve better, more choices. They deserve better healthcare. And so I'm like, I can do this. So I partnered with my nurse practitioner, Angela Wicks, and she has over 15 years of experience in hormone balancing. And then we have 4 other licensed practitioners, and we have provided them all with extensive training in bioidentical hormone replacement therapy through different academies. We also partner with our medical advisor, Dr. Paul Gerstenberg, out of Texas, and he has owned his own clinic for over 24 years in functional medicine. So we have this was started so that we can really just listen to women, so that we can provide them education, empower them, and to help them.
It seriously is thrilling to talk to people like you because most women are in the system, going to the regular doctors, only being seen for 10 minutes, super frustrated that they're not being listened to. And I quite frankly didn't even know that companies and providers like you existed. I didn't even know that I could look outside of like my network, that's provided inside my insurance. And I was not finding the help that I needed. I mean, I am your typical story where everything hurt and I had no libido. And I went to my gynecologist. She tested my hormones and came back and said that my levels were normal and that this was just part of getting old. And I thought, there's no way I can live like this. I felt 80 years old. Everything hurt. I couldn't even go for long walks. And I just thought, I didn't want to wake up in the morning. Exactly. And one of my friends, said, you've got to go find a hormone therapist. And it's really hard to find a hormone therapist, really hard. And nobody knows where to go. And that's why I feel so lucky to have found people like you. And then be able to send more women to you. So walk us through. I want to make sure that women feel Like they're coming home. I want them to know exactly what they're walking into, so that they will call you, right? I mean, let's get started and let's not stop guessing. Honestly, I see a lot of women still ask me, what type of blood work do I need to give my doctor so that they will, help me with my hormones? And my first reaction is, if you have to tell your doctor what kind of blood work they need to draw, you're already with the wrong doctor. Like that, you should not have to educate your doctor on what blood work to do when you're in perimenopause.
Very true. I get women that email me or call me every day and they're like, well, I've got my labs from my doctor. I'm ready to be seen. I'm like, that's great. Send them on over and we take a look and there's not even one hormone level in the lab. And I was like, I'm glad you did labs, but they didn't check even one hormone, or they might check one very basic one. And so, that's one thing we're looking at. You can always pick up the phone. You can call us, email us. We have online chatting from our website at balancedhormonehealth.com, and we can start the conversation there. So you get to know us. We're going to help you get your blood work, or if you have blood work, we're happy to look at it, give you analysis of it. And then once we have all that, we'll have you complete paperwork, and then you'll have an hour consultation, video face-to-face with our practitioner, and she'll go over those labs and then give like recommendations or options, or answer any questions that you have. We do specialize in injectables, but we can help you with whatever, and we don't charge for the little things. We're not there to try to, like, if you need help with your thyroid, we're going to help you. We don't charge extra for that, because it all works together. If we can't put together a program that makes you feel your best, we're not going to help you. So we want to help you. So it takes a piece of everything to do that.
So let's talk specifics. When somebody clicks on the link that is on the Wake Her Up directory, so here they are, they already found you, they probably came to this from the directory. So once you're done with this introduction video, underneath this video, there's a link that says book your consult. Once they click on that, there's a form that they're going to fill out. It's just your basic information form. From that form, do they get to talk to you for a minute to kind of decide if this is the right fit for them, or what is that next step?
They can if they want. So once we get the form, we will reach out to them and then see how they want to be contacted. If they want to be text, if they want to be called, or just back and forth emails to go over things. So we want to talk to them. We want to tell them a little bit about our program and make sure that they have all the information they need before they even take that next step. We want them to feel comfortable with us. And that's why we try to keep our website really open, really transparent. You can see all of our pricing. You can see everything about our products on there. And we want you to be confident before you even come in. After that conversation, if you haven't had your blood work, we'll help you get set up with blood work. We can have it drawn at a local LabCorp. That's $100, and it's a really good panel, and we're happy to add on anything. We don't charge a lot extra for that, just basically our cost to add whatever other levels you might want. But it's a really good panel to get started and to kind of look at.
Do you know how many biomarkers you are testing with that $99?
Work. I don't have it right in front of me, but I believe it's like 48 biomarkers in that $100.
Amazing.
Yeah.
Amazing. So what you're saying is $100 for the blood work plus, and is it free? Like the full hour consultation is included in that $100?
Correct.
Amazing. Correct. Can you imagine? I mean, most women have never talked to a doctor longer than 15 minutes. I mean, I've experienced this where it's an hour consultation, and it is wild to me for the physician to ask me, tell me what else? Like, okay, what else? What else? Like, I see this marker. Are you dealing with any stress, trauma? How's your marriage? Not that they're marriage therapists, but they recognize that, are your children healthy? Are they going through stress? Are your parents healthy? Are they going through stress? Are you caring for your parents? What is going on in your life? Because they recognize that all of those things end up in your body. And it's just beautiful to be able to talk to a doctor and then we also know that most gynecologists never bring in like nutrition. They don't ask you what you're eating. I remember sitting in my gynecologist's office after she told me all my hormones were fine. I had a baby she was about a year old. I still had the extra baby weight on me. And she looked at me and said, well, your BMI is kind of high. And I just thought that's what we're going off of. And it's not like I was excessively large person.
Right.
And then I just thought, she didn't even ask me like what I'm eating. What if I'm eating this really clean diet? Or what if I'm eating pizza every night? She just didn't care. And I love that. Yeah. When you spend an hour with a physician, all of that is talked about and it is all considered and you feel so seen. I just love it so much. Okay. So you've got an hour consultation.
Correct.
Then you're able to prescribe from there. And when you do prescriptions, walk me through the time frame from getting prescribed until that medication arrives, because I know every woman listening to this is like, I needed it yesterday, right? And we want it to show up in the mail tomorrow, right? Because now we're so excited. We have solutions. We know what's going on in our body. We're like, get it in here. But give us a realistic time frame from getting off the phone to when it gets in the mail.
Definitely. As soon as you get off the phone with our practitioner, within 24 hours, our wellness nurse will reach out to you and she'll help you walk through kind of all your options that you went over with the practitioner and then make your selection. Once you purchase the product, it typically takes about 7 days for the compounding pharmacies to manufacture the medication and get it delivered to your home. We say allow 10 days just in case, but I would say right on average, it's 7 days. So.
And we also know that there are some states that it's a lot of trouble to sometimes get the testosterone as an injection just from all the different laws that are going on. And it's really super frustrating. But how do you work around that? And do you ever run into situations where people are in states where you like simply just cannot get it to them? Or walk me through that.
We've been pretty fortunate lately because we work with so many different providers. We have our 5 practitioners with multi-state licensing, and then with our pharmacists that are licensed in multiple states too. There are, of course, ways that we can help you still, but there are a few states where we just cannot provide service at this time until regulations change in those states or something, which is very unfortunate for women. But we will do our best. If we can't provide service to you, we'll direct you to someone that can.
Well, and that's what's nice about being part of this Wake Her Up community, because if you're not able to, we can easily go back to the Wake Her Up directory, find someone that is local if that's what you're needing for that state, and you guys can all work together. That's fantastic. Okay, so now let's say we've got all the amazing things that are starting to go into our body. Let's say I'm on it for a week or two and I'm feeling like, am I doing this right? I'm not sure. Maybe I do the testosterone injection and I get a bruise in that spot and it's really itchy, something like that. Right. How accessible are you, and how do your patients communicate with you?
I think that's one of the things most of our patients like best, is that we're very communicative. We're pretty much always available and we're quick to respond. Like, a delayed time might be a few hours. Of course, we have some exceptions to that, but our wellness nurse, Lindsay, is always available. You get our cell phone numbers. You have my cell phone number. I'm answering questions all the time, day and night. Occasionally, if I'm at a soccer game or something, I'm a little bit slower to respond than others. But we're really here to help. We want to make this successful for you because I want you to feel as good as I felt. I went through all that, and I know the pain and suffering that you go through. And that once you get feeling that way, you're like, oh my gosh, I'm never going back to that, to feel that. Like, I took my injection this morning and it's just like a breath of fresh air as soon as I take it. I mean, honestly.
It's so good.
Yeah.
I just took my testosterone yesterday morning, and then you go to the gym and you're like, oh, there it is. Like, it just feels so good. This is one of the reasons I just adore you and love that we have you on the directory, because you come with this like small town feel. You're not so big that you can't give out your phone number. And that might change. I mean, I'm like, maybe we need to keep this a little secret, but I hope that, you're able to maintain that as you grow. I know that's tricky and you have to do what you do, as a small business, but as you're getting bigger, I think that's so important, that personal touch. And I just love that that's what's really important to you, and that is what you're able to offer right now. And I hope that the women or men that contact you now are able to experience that and get that personal, one-on-one, and just feel like they have someone in their back pocket that's really walking them through this. And then walk me through how often are you doing follow-ups, and is there, all the costs associated to those follow-ups? And yeah, let's start there.
Yeah. So the best part about us, like sometimes people are like comparing all these prices, I see it online and someone might be like, well, that sounds really expensive, but you got to take in consideration the whole picture, how many milligrams you're actually getting for that, the size of the vial, consultation price. Ours is all inclusive. So we leave the price, what you pay that's what you pay. So the vial of testosterone is $200. That lasts most women almost 6 months. So you're looking at $34 a month. And that includes any consultation you have with us. And all the supplies, all the shipping, everything is included in the price. So you can if you need a consultation once a month, we're going to provide that for you. Realistically, most women we follow up with in the first 6 to 8 weeks, make sure that they're doing okay. If they have any questions, if we need to do some dosing adjustments, and then it's quarterly from there. So we're looking at once a quarter, checking labs just to get to that optimal level. Cause the labs are necessary to help guide us, because we don't know how to tweak your medication in which direction without that. Of course, we're going by your signs and symptoms. How you're feeling is number one, but number two, we have to look at those labs to help guide us. So once a quarter till you kind of get balanced out. And then once you're like, I feel it, I feel awesome, then we can kind of spread that out a little bit, but we're always available and we do not charge ever for our consultations.
That's amazing. So really just looking at the $100 labs, every quarter until you're just feeling like, oh, we don't need to do that. I feel like we're in a really good spot.
Correct. So
that's amazing.
I've been doing injections myself for almost 7 years now. And so I've been balanced for a really long time. So I get my labs done once a year, sometimes twice a year, it just kind of depends how I'm feeling. Cause I can basically tweak if I need to, but I'm pretty stable. And so that would be our hope, is that you would get to that point where you're not having to do labs all the time, but just as a well check to make sure that everything's kosher, everything's going well for you.
I think that's the magic of women doing hormone therapy, is that, and working with physicians like your doctors, is we start getting really connected to our body. We start listening to it, and we start understanding, when we tweak this is what it feels like. When we tweak that, when it's high here, when it's low here, this is what's actually happening. This is how I adjust. And as you do that more and more and more, and associate with blood work, you see it.
Yes.
And you get really good at being in your body. Like, that's what's crazy. You get really good at this just for yourself. And then you feel comfortable adjusting as you need to.
Yeah, that is so true. That is a very good point. When I first started, I was keeping track of my labs, and then I'd be like, okay, I'd write down how I felt when my levels were that, and then I could see the pattern, and I was like, oh, you know what? My orgasm isn't as strong this week, I'm going to give myself a little more tea, and boom, there it is, And so just finding those right levels, taking control of your own hormone health. And that's what we really want to empower women to do, is to feel comfortable, get to know themselves, know their options, know how to treatment. I mean, we're in charge of our own bodies, and we should know what we feel good at. And with injections, it's so easy to adjust and really fine tune that. And if you can take control of that yourself and really listen to your body and just let us help guide you, it can make a world of difference.
Oh, it's amazing. What a difference it is to go from a doctor who's like, if you're going to change the dosage or anything, you have to come back, make an appointment with me. We have to approve it. They kind of scare you into like, this is medication that you cannot change unless it is approved. And then you work with doctors who are getting like, it's your body. Like, I don't know, you need a little bit more, you need a little more. You want a little less, take a little less. Like, do what you got to do, because you understand that hormones and this type of adjusting is more like supplements than it is medications, right? and you trust what women do with their own bodies. What a concept, right?
We trust how you feel, and you're exactly right. You're just supplementing. So just tweaking here and there. We even write our scripts like that. We leave, you can vary from here to here. It's so you can have the control you need. And that's why we give you the entire vial. We do the same with our GLP-1 medication as well. You get the entire vial and we guide you, but ultimately you can go up and down in dosing as your body needs, because sometimes you need a little more, sometimes you need less.
Yeah, I love this so much. I mean, when I started Wake Her Up, it wasn't anything to do with hormones. It really was women getting connected back to themselves. And now it's wild because that's really what we're doing, really, just in the context of hormone therapy. We're like, we're putting you back to your body so you can listen to yourself and kind of wake yourself up. Just to be really specific, because I know it's going to come up, and I know this, all of the providers in our network, they all offer testosterone, progesterone, they all offer estrogen, they all can help with like thyroid guidance. And all of them offer GLP-1s. Is there anything that I'm missing here that you feel like make sure that they know we all also offer this? I know that there's peptides, and then maybe there's something you want to speak to. I know you keep saying injections with estrogen. Do you also offer the patch or vaginal estrogen or any of the creams?
Yes, very good point. So everything that we have is listed on our website. Plus we have other options as well. We do not have our peptides on there right now. We do some peptides and some supplements. We keep it pretty narrow to the ones that we really feel are helpful. So we always do all of our testing in-house, outside of house to figure out what works best. How I feel, I've pretty much used everything that we offer. But yes, our specialty is injectable testosterone and estradiol, the oral progesterone. And then we will provide, like, if someone tries injectable estradiol and maybe that's not their thing, or maybe they don't need it yet, we'll just write you a script for patches. We have cream options as well, and then vaginal estradiol as too. So
amazing.
Yeah. So, and we try to work within our client's budget, because that was one thing when I was a patient, some of these clinics I went to were, it was a big investment. I would pay, $600 for the appointment plus some dollars for labs. And I'm like, it doesn't need to be that way. So sometimes we get women that come to us and they're like, okay, the testosterone injections is what I need from you. I can't get that from my other one, but my other doctor will prescribe, progesterone from my local pharmacy. And I said, that's great. Or we'll send a script for you. If you don't want to do the extended release through our compounding pharmacies, we send a free script into the pharmacy for your progesterone.
That's amazing. Oh my gosh. Well, I just love what you're doing. I love how you set it up. I think it's really important that women understand that companies like you are out here and that they're safe and trustworthy and committed to helping women until they feel good, right? Like, you're not just here to just dish out your supplements and, sell some products. You're here because you want to help women feel good. That is the product. Yeah. The product is women feeling good. Yes. And I think that that's the thing that women need to understand, that when you go to a doctor inside your insurance network, you are not the product. They get paid whether you feel good or not.
Yeah.
Right? Your company only grows. You only get recommendations. You only get people coming back to you when you help women feel good. That's how your business functions.
Exactly.
And I think that is so different. Women are out here trying to find someone that takes their insurance, but then we're slapped with like surprise bills that we didn't know we were going to have, because lo and behold, insurance doesn't cover that. And I really do think that the health care that women need is out of pocket, and it is not as expensive as women think it is. Now, It can be if you go to different places, but when we find people like you that are offering it for $100 plus the, including the consult, not marking up all of these things to the wazoo. It's just, and having clear pricing. I feel like it's such a safer option than even going through insurance, because they just have no idea, no clue.
Definitely. People are always asking, well, do you take insurance? We do not take insurance, but we take FSH and FSA cards. And, but most of the time people find that our prices are way better than what they would pay with their insurance. So like, for example, if you want a script for labs for your insurance, we'll give you a free script to take anywhere with and utilize your insurance if you have really good insurance and feel like that. But I do caution clients, because a lot of times they'll do that thinking their insurance will pay for all these labs, which, they don't, unless you meet your deductibles sometimes. So they'll come back and be like, these same labs were $807 through the Blue Cross Blue Shield that they could have paid for $100 if they did cash labs. So just keeping that in mind, that I know it seems a little scary paying out of pocket at first, but usually in the long term, you come out way ahead.
I mean, I had some of my first labs go through my insurance, and my payment was still $97.
Yeah.
Right. Like,
and that's pretty good, actually. But
yeah. Right. I mean, I was like, yay, only $97. But how nice would it be to not be like, I don't know what they're going to cover. Right. Yeah. And then you just get the surprise bill. I would way rather just say, oh, it's $100. And like, that's it.
It's nice that you can control the price, and you can still get the detailed receipts and submit that towards your deductible, or you use your, health expense cards too. So
amazing. Well, to wrap this up, what do you, as the owner, hope that when women call, what do you hope, after 6 months of working with you, a year working with you, what do you hope for them?
I just hope that every time we see a new woman, that they come out of that appointment and they feel really heard, and they feel educated and empowered to take control of their hormone health, whether it's with us, with their primary, with whoever services them best. But they deserve that. They deserve to know that their options are out there. They deserve to know how much things are going to cost them. They deserve to feel their best. And that's my goal, is for everyone to just feel like a better version of themselves, and that they'll say, hey, and tell their best friend, tell their mom, tell their sister, take a look at your hormones, all these things going on, and people just contribute it to getting older, or that's just normal. We want them to know that that's not normal. We don't have to live like that, that you deserve to feel your best every day. And, and that's what we're here for. And that there's clinics like us out there that are here to help women, that can provide something, that testosterone isn't scary, that it's amazing. And that, we had way more testosterone in our 20s than we have estrogen. And so don't be afraid of it, to just learn, study it for yourself, read the articles, and then to reach out and have a discussion.
Oh my gosh. Thank you so much for being here. Thank you so much for doing what you do. Everyone that's listening, whether through the podcast or you're right here watching it on the website, go to Balanced Hormone Health, schedule your blood work, go talk to Jill and her team. Let them help you. They know the blood work that you need to get done. They know how to help you. They're going to work with you until you feel good. So click on the schedule your blood work button and go start feeling good. Thank you so, so much.
Thank you, Marcella. I appreciate it.